Hello future nurses, confused about electrolyte imbalances? In this video, let's make magnesium imbalances, that is hypomagnesemia and hypermagnesemia clear, including causes, clinical manifestations and management using easy mnemonics so that you never forget. So let's begin. Magnesium. The normal level of magnesium is 1.8 to 2.6 milliequivalent per liter. Magnesium is essential for muscle contractions, nerve conduction, enzyme activity, and cardiac rhythm. To remember this, we know that symbol of magnesium is Mg. So we can remember Mg as muscle governor. Now it is easy to remember the function of magnesium. That is, magnesium governs the muscle, means it is essential for muscle contraction and also for nerve conduction and cardiac rhythm. Now, the normal level is 1.8 to 2.6 milliequivalent per liter. So, two conditions occur when magnesium is out of balance, either hypomagnesemia or hypermagnesemia. In this video, let's discuss hypermagnesemia. Hypermagnesemia, a condition in which serum magnesium level exceeds 2.6 milliequivalent per liter. That is, serum magnesium level is more than its normal level, that is more than 2.6 milliequivalent per liter. Let's discuss the causes for hypermagnesemia. We know that hypermagnesemia, that means there is more magnesium than the required amount. So the causes mnemonic is high mag. In this video, let's discuss hypermagnesemia. Hypermagnesemia, a condition in which serum magnesium level exceeds 2.6 milliequivalent per liter. That means serum magnesium level is more than its normal level in the body, that is more than 2.6 milliequivalent per liter. Let's discuss the causes for hypermagnesemia. We know that hypermagnesemia is a condition in which there is high magnesium in the body. So to remember the causes, we have the mnemonic that is high mag, that means high magnesium. Now H. Here H stands for hemodialysis patient. Hemodialysis patient means the renal failure patients. In renal failure patients, magnesium is not excreted properly by the kidneys, leading to the accumulation of magnesium in the body. So hypermagnesemia develops. I stands for increased magnesium intake, antacids, laxatives, or supplements. If there is too much magnesium intake by the patient or by the client, that can be magnesium containing antacids or laxatives. So, if the person is taking more magnesium, due to which there is the condition of hypermagnesemia. G stands for GI absorption increased due to any bowel disorders. If there is any bowel disorder or the bowel movement is slow, then there is increased absorption of magnesium from the intestine. Due to increased absorption, potentially there is high magnesium level in the body. H. It stands for hypoaldosteronism. We know that aldosterone causes kidneys to excrete magnesium. So if there is condition of low aldosterone levels, that can lead to retention of magnesium in the body. M stands for magnesium therapy. If the person is receiving excessive IV or oral magnesium administration, that can cause magnesium toxicity, that is hypermagnesemia. A stands for Addison's disease. Addison's disease is an adrenal insufficiency, and this also causes decreased kidney excretion of magnesium. So, as a result, more magnesium is accumulated in the body. G stands for glomerular failure or renal insufficiency. We already discussed if there are damaged kidneys or any kidney failure or kidney problem, the kidneys cannot excrete magnesium effectively, so the level of magnesium rises in the body. So these are the causes of hypermagnesemia. And the mnemonic is high mag. Hemodialysis patient, increased magnesium intake, GI absorption increased, hypoaldosteronism, magnesium therapy, Addison's disease, glomerular failure or renal insufficiency. Let's discuss the clinical manifestations. We know that magnesium acts as a sedative in the human body, and if there is condition of hypermagnesemia, means more magnesium, so every function of the body is low and slow, means activity of every function of the body slows down. So to remember the mnemonic, to remember the clinical manifestations, we have the mnemonic that is calm down, means everything calms in the body because magnesium acts as a sedation. So C stands for cardiac depression, bradycardia, hypotension, heart block, CNS depression, confusion, coma, changes in ECG. As high magnesium acts as a depressant, so it will slow the heart rate, will lower BP, hypotension, heart block, confusion, coma. All these conditions or all these manifestations may occur due to hypermagnesemia. A. A stands for absent or diminished deep tendon reflexes. These are these are depressed due because excessive magnesium will depress the neuromuscular transmission, due to which there is loss of deep tendon reflexes. And the loss of deep tendon reflexes or the absent or diminished deep tendon reflexes are the earliest signs of magnesium toxicity. L stands for lethargy. The person will be lethargic, will feel tired, weak, sleepy. M muscle weakness. The person may experience skeletal muscle weakness, and also high magnesium will affect respiratory muscles too, which will lead to shallow respiration or apnea may develop. D stands for decreased respirations, shallow respirations, drowsiness, decreased bowel movements. O, output of urine decreased. Because of high magnesium, kidney function is impaired, so urine output drops. Oliguria develops. W, weak pulse, warm, flushed skin. Magnesium causes vasodilation. So, due to vasodilation, flushed skin and warm sensations occur. N stands for nausea and vomiting. Due to high magnesium in the body, the GI system will also slow down and the smooth muscles of GI will relax, due to which nausea, vomiting, and sometimes constipation may also develop. So these are the clinical manifestations of magnesium, and we know that magnesium acts as a sedation. So we can remember the mnemonic calm down, means if there is high magnesium in the body, so more sedative effects will occur in the body. And the mnemonic calm down, that is cardiac depression, CNS depression, absent or diminished deep tendon reflexes, lethargy, muscle weakness, decreased respirations, drowsiness, decreased bowel sounds, output of urine decreased, weak pulse or warm flushed skin, nausea and vomiting. ECG changes. Let's discuss the ECG changes that occurs due to hypermagnesemia. Two main ECG changes occur that include prolonged PR interval and widened QRS complex. This is a normal ECG wave. As we can see, the P wave, the QRS complex, the T wave, the PR interval, and the QT interval. So this is a normal ECG pattern. And this is a ECG in the case of hypermagnesemia. As we can see, the PR interval is prolonged in case of hypermagnesemia, and also the QRS complex is widened. So these are the two main ECG changes that occur in the condition of high magnesium in the body, that is prolonged PR interval and widened QRS complex. How we will manage the condition of hypermagnesemia? Let's discuss the management. We know that hypermagnesemia is a condition in which there is high magnesium. So the mnemonic for management is to decrease magnesium. So we can remember the management by the mnemonic decrease magnesium. We have to decrease the level of magnesium in the body. Here D stands for dialysis. If patient has renal failure or magnesium levels are very high, then hemodialysis can be done to remove excess magnesium from the body. E stands for eliminate magnesium intake, antacids or laxatives. We can stop all the magnesium containing medications or supplements, means we can restrict magnesium intake, sorry. C stands for calcium gluconate IV. Calcium gluconate acts as an antidote for hypermagnesemia. So we can give calcium gluconate IV. R stands for respiratory and reflex monitoring. We have to monitor the respiratory rate, depth, reflexes, because high magnesium will cause sedation effects. E stands for excretion using diuretics. We can use loop diuretics with IV fluids to enhance renal magnesium excretion so that kidney function is adequate, and by giving diuretics more magnesium can be excreted from the body, and diuretics like loop diuretics can be given. A stands for assess ECG continuously. As we know that if there is high magnesium in the body, cardiac depression occurs, so we have to monitor ECG continuously. S as a sportive care like oxygen, BP monitoring, emergency readiness. We have to provide sportive care to the client. E. E stands for educate to restrict magnesium containing foods. We can instruct the patient to avoid magnesium rich foods like nuts, seeds, whole grains, or green leafy vegetables. So, this is the management for hypermagnesemia, and the mnemonic to remember this is decreased magnesium. Dialysis, eliminate magnesium intake, calcium gluconate IV, respiratory and reflex monitoring, excretion using diuretics, assess ECG continuously, sportive care, and education to restrict magnesium containing foods. So, this is all about the condition of hypermagnesemia, including its causes, clinical manifestations, and management, and also including the ECG changes that occurs due to the condition of hypermagnesemia. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.